Ladies and gentlemen, this is an article that came out today. Um, and I will leave the link to this article in the description box. I think it's Jalopnik. Um, America's auto industry is at the heart of the opioid crisis. My father was a United Auto Worker for 31 years. So, this is something that I'm pretty familiar with. Okay. I'm just going to go down a little bit. Now that you're all rested up and cheered after Thanksgiving, here's is a depressing trend piece, as you might expect, given the location of the crisis. America's auto industry finds itself increasingly dealing with the opioid plague, addiction to prescription painkillers and heroin that now kills more people each year than guns or car crashes. The report comes from Automotive News, and it's worth a read in full as policymakers come to grips with how to address the crisis. While there aren't hard numbers on addiction deaths for specific automakers, here are some notable tidbits. Plants responsible for more than 70% of the Detroit automakers' U.S. production are in states identified by the Center for Disease Control and Prevention as having statistically significant increases in drug overdose deaths in 2015, the last year for which data are available. All six of Fiat Chrysler automobiles, U.S. assembly plants, seven of Ford Motor Company, eight plants, and eight of General Motors. 12 plants are in those states. So, are three of the four largest auto plants in the country: Nissan's factory in Smyrna, Tennessee, Toyota's in Georgetown, Kentucky, and Honda in Marysville, Ohio. Why is this happening at auto plants? A lot of it has to do with the nature of the work. It is repetitive and often dangerous. Plus, drug and alcohol at auto plants is nothing new. It is just that drugs are probably more devastating than they've been in decades. Addition, policies at the plants basically states relapse will cost workers their jobs. So they often don't seek treatment or tell people. Automakers have programs to help workers with addiction and mental health disorders, but the programs aren't necessarily equipped to handle the long recovery times that opioids require. And workers who fear for their job security are often reluctant to seek help, especially if they've lapsed more than once. Auto assembly jobs physically demanding, with workers repeating motions and staying on their feet for long hours, creating an environment in which opioid use can easily get out of hand. They're doing 11 hours a day, says Kevin Bush, an employee support representative at Ford's Louisville assembly plant in Kentucky. Assembly work is very boring and very tedious. That kind of work causes many aches and pains in their bodies. Maybe they have a pain and a doctor prescribes opioids. And over a period of time, the use of that creates a high tolerance and addiction. And one thing leads to another, and it gets worse. The story also details the UAW members and automaker employees are trained to keep an eye out for signs of addiction, then provide services that can help, like treatment programs and counseling. But this is a problem that can't be fixed until it's addressed at the healthcare provider level. Again, worth a full read. So, generally what's happening in the country right now, we know that there's a lot of people that can't pass drug tests, and that's for pre-employment. But there's a lot of people in this country going to work high every single day, every day. And more employers are performing tests on some employees that's been there for a long time, and many of them are failing. And these employees are now dropping productivity on these jobs are dropping all over the country because of the drug addiction that's going on. And that's one of the biggest complaints a lot of these businesses are having now. They've been running their businesses for years, and they are losing a lot of money because these people are coming to work high. They're not performing all that well on the job anymore. And so now, their businesses are suffering. So the auto industry is really no different as far as production is concerned. So it's just as bad as any other industry that's out here. But I will leave the link to the article in the description box, and that way you can come out and read it on your own. But I do know just from reading several articles, especially when it comes down to employment, there's a lot of industries out here that are suffering because of so many employees that are just high every single day on jobs. And, it's not much they can do because the people that they try to replace them with, they're coming in the company as junkies. So this drug plague is way worse than you can imagine, and they know it. You know, they're never going to tell you what the real true number of addicted people in this country because they are deeply embarrassed by it. But please tell me what you think. Please leave your comment and subscribe, and don't forget to hit on that notification bell. Peace, family.